Hi, Raquel. I just want to say hi. I feel like it's been a minute.
I know. Good morning, beautiful humans.
Good morning.
Good to see
Welcome,
and hear
everyone.
your voice, Marina. Hi, Tasha. There's Raina. I'm going to stretch my screen out so I can see some faces. Hey, Doctor. Robert's in the house. Weren't we supposed to talk to each other, Doc?
You dogged me. You
I
dissed me.
forgot.
It's all right. I was so busy. It's okay. I was laying in bed and I said, what was I supposed to do? And I looked at my calendar. I go, you know what? Raquel dissed me. It's all right.
Hey, Renee.
Good morning. How are you?
Good morning. Beautiful lipstick.
Oh, thank you.
Good morning, Miss Barnes. How you doing, Michelle?
More importantly, how are you, Raquel?
I'm doing okay. It's been a
I
bumpy few weeks. Thank
I've
you.
been keeping really involved from the back, and I owe you a sincere apology. That's on us.
Oh,
So
thank you.
we won't let that happen again. I promise you.
I know. That's why I trust. That's why I went to you. Thank you, Michelle. I appreciate it.
Yeah. Stephen worked a miracle. So I want to let you know that man was a miracle. He made exceptions I've never seen done in the state of Colorado, but he did it. Yeah, I apologize.
Thank
That
you.
was on us.
Thank you. Thank you. Thank you. Thank you. That means more than you know. Thank you.
Yeah, I hope everyone just heard that. We had a mistake made, and part of BHA. Well, I can talk about it in my remarks when everyone's on, but uh, I'm glad it ended as well as it could have, even if it didn't end the way it should have. Good morning, Catherine.
All right, well, Marisa, I'm going to grab.
All right, you all, it is 9:02, so we are going to go ahead and get started because we do have a full agenda today. Welcome everyone. Thank you for being here with us today. I am Megan Shelton, Division Director of Intergovernmental and Community Engagement at the Behavioral Health Administration. And we will go ahead and get started with our meeting. Next slide, please. I am going to go ahead and read this slide to you. I just got notified that we do not have interpreters for this meeting today.
Okay.
They are working on it. They're working on resolving it and seeing if we can have if they can join us, even if it's just a little bit late. We did schedule the interpreters a couple of months ago, and so we're working with them to resolve that issue. So when they do come on, I'm crossing my fingers that they will join us, that during the event, your participants' view will follow the view of the BHA panelist. And the BHA panelists will ensure that the ASL interpreters are pinned to be visible to you at all times. So when they join, you will see them pinned. If you cannot see them, please notify the panel through the question and answer function at the bottom of your screen. And you may adjust the ratio of a screen being shared and panelist videos visible by hovering your cursor to the left of the panelist until your cursor changes to a horizontal arrow. You can then left click and drag your cursor across the screen until you have reached your preferred view. So I know some of you are not as familiar with Zoom, so it takes a little bit of time, but feel free to reach out to us if you're having any questions seeing any part of the presentation today. Next slide, please. Closed captioning has been enabled for this event. Click on the closed captioning button at the bottom of your Zoom window to turn on subtitles. If you need to change the subtitle language, click the caret to the right of the button and translate to your chosen language. If you're having technical difficulties, please direct message Marina Borisov in the chat for help. I'm sorry, I just saw something pop up. If you are a member of the public and having technical difficulties, please message Marina in the Q&A. Next slide, please. Again, want to extend a warm welcome to all of you for joining and the time that you commit to our council today. I will pass it over to Jason Chelsea, who is going to take attendance.
Good morning and Happy New Year, everyone. It's our meeting for the 18th of January. I'm going to go ahead and read your name. Just let me know that you're here. Renee Anderson,
I am here.
Ash Annan,
Present.
Robert Archuleta,
Here.
Raquel Garcia,
Present.
Carolyn Hall,
Present.
Tasha Conker,
Present.
Dr. Ronley Leah, Maria Martinez, Dr. Stacy Oberly, looks like Dr. Ron Leah,
I'm here. I'm having some trouble with my audio, so I'll hop on my phone too. Good to see you all. Thank you.
Noor Shafi,
Present.
Raina Shaner,
Present.
Andrea Sivanovich,
Here.
Jamie Ulrich,
Good morning, I'm here.
Cameron Vigil,
Present.
Catherine Washington,
Good morning, present.
Seth Watkins,
Good morning, present.
and Selwyn Whiteskunk. Yeah, I believe that was it.
Thank you, Jason. Raina, I'm seeing that your sound is cutting out. I am not sure if there's anything we can do on this end. Is anyone else having that issue, or is it just, it might be on your end? I'm not sure if we can resolve it on our end. Okay. Marina, if you can reach out to Marina, but it sounds like sounds like others can hear us, so it might be on your end. I'm sorry. And I hope that you can get it resolved. Next slide, please. Few housekeeping items. All council members are able to unmute. Please raise your hand to be acknowledged. Prior to speaking, please identify yourself. The Q&A feature is open for all attendees. However, substantive comments and questions may not be addressed in real time. The chat feature will be open for the last 10 minutes. The council will determine how to address any public comments and questions we do not get to today. A recording is in progress for note-taking purposes and for any council members not in attendance with us today. All future meeting dates, agendas, and minutes will be posted on the BHA website. Any questions or comments regarding the council or BHA can be submitted via Contact Us section on the BHA website. Tasha, I see your hand up.
Yes, about our transcripts and stuff and recordings for the public. I was wondering, is there by any chance that we could get this fixed? Because a lot of the stuff is not recorded properly and in our access in our Google Drives and stuff like that, as well as the transcripts for the meetings, because we only have the chat. So I was wondering if we can get the transcripts for all the meetings that we've been in. Thank you.
Thank you, Tasha. I will look into that. And feel free to reach out to me directly as well via email. Okay, next slide, please. Group agreements, I realize that these are our old group agreements, and we are going to use them today, and we'll have a little bit further discussion around that during the BHAAC business portion of our meeting today. So for today's group agreements, listen and engage respectfully. Differences of opinion are natural and useful. Have an open mind, be curious, and be bold. Everyone has equal voice and valuable contribution. Take space and make space. Keep to time and agenda. Start and end meetings on time. No acronyms, please. And it is okay to turn off your camera and take time to reset at any time during the meeting. Self-care is really important, and we realize that sometimes difficult topics come up, so please take care of yourself as a top priority. Next slide, please. Okay, our agenda for today, we already did the call to order. We will then vote for a temporary chair, and want to encourage all of you who have not had an opportunity to volunteer today to be a chair with us. And Tasha, I see you're shaking your head in encouragement. Please know that if you volunteer to be a chair, you are not left in the dark to do this. You'll have me direct messaging you, reminding you of time and things like that. So you're not alone in figuring it out. I'm right there with you, and really want to encourage anyone that would like to have this opportunity to lead with us. When we do vote for the chair, which will be after this review of the agenda, I would like for us to vote for today's chair as well as the chair for the March meeting. And that way, if you're not feeling quite brave enough to chair today's meeting, you can volunteer to chair the March meeting, and I will meet with you in between and help you feel more comfortable doing that. So keep that in mind as we move forward. Following that, we will vote on the November minute approval, followed by a commissioner update. Commissioner Barnes is with us today, as well as Deputy Commissioner Kelly Kelsey. And following that, we have BHAAC business to cover. Our break is from 10:15 to 10:30, followed by a legislative update. And I will be transparent with you that our policy team were pulled in multiple directions today during this time, so they could not join us, but did give me information to provide an update to you all. I know you will have questions that I may not be able to answer, but I will find those answers for you and get back to you during that time. From 10:35 to 11:50 is the Child and Youth Behavioral Health Implementation Plan. I know many of you joined us for the stakeholder sessions. And so this will be more of a high-level brief presentation, and hopefully you all had time to review the materials that I sent to you all on that plan. And then really the majority of that time will be focused on hearing from you and your guidance and your reflections on what's going on in that plan, your questions, full discussion like we did during our last meeting on the grievance report. And then 11:50 to 12 o'clock is open for public comment. All right, next slide, please. And here we are, time to vote for our temporary chair of the day. So please raise your hand if you would like to volunteer to chair today's meeting. All right, you all. Raquel, I saw that you cannot stay for the entire meeting, but would like to volunteer to chair the March meeting. Nor, it sounds like you are under the weather and not up to it today. But would love to have you chair another meeting. I know we have some great leaders on here. And Tasha stepped up last month and did an amazing job. Tasha, do you have some words of encouragement to get us a volunteer?
As nervous as I am about public speaking, and if you guys listen to the audio, you know that it was very it's fun. It's fun. You guys should do it. Try it just once. Let's do it.
Come on, you guys. I know someone is willing to do it. Oh, Cameron. Oh, a later meeting. Okay, we have a lot of volunteers for a later meeting, but we really need one for today.
If I wasn't having an audit today, and the day they picked an audit is today for me. Otherwise, I totally would be willing to.
I'll do it, Megan.
Who is that? I don't see you.
Jamie.
Thank you, Jamie. Okay, Jamie has volunteered. Thank you so much, Jamie. And so now we will move forward with vote. Who is in favor of Jamie Ulrich as our chair of the day? Okay, I see some hands up. I see some physical hands up. It looks like Jamie Ulrich is our chair of the day. Thank you, Jamie. And so real quick, can we vote for our March chair of the day so we don't have this awkward silence at our next meeting? So raise your hand if you would like to chair March's meeting. It looks like in the chat we have possibly a few volunteers. So I see Raquel's hand. I know Noor and Cameron, I think I'm looking back through, had both said that they would be willing to chair a future meeting. So just wanted to give you that opportunity if you're interested in March meetings as well. I don't want anyone to lose out. Okay, just looking at the comments. So Noor, you were not volunteering for March meeting, right? I just don't want to miss you. Okay. And Cameron?
No, thank you.
Okay. Okay. Who is in favor of Raquel Garcia chairing our March meeting? Please raise your hand. Okay, we have our chair for our March meeting as well. Thank you. Okay, next slide, please. And I will pass it over to you, Jamie.
Okay, thank you, Megan. Thank you, everyone. It's always nice to see all of the encouragement and the little emojis that fly around with the clapping and the, woohoo things. So that's always fun. So thanks everybody for all of the encouragement. We're going to talk about our November meeting minutes. Does anyone have any changes to the November meeting minutes that we need to consider? And if not, can we get a motion to approve the minutes and a second?
I motion, Tasha Conker, motions.
Thank you, Tasha. And a second?
I make a motion to second.
Thank you, Carolyn. So we have a motion and a second. All in favor, please raise your hand. And I don't know, Megan, if you're counting hands or if I'm counting hands.
I will count hands.
Okay. Any dissension in approving the November minutes, I guess, is a better way of doing that.
We definitely have majority.
Okay. November meeting minutes are approved. Thank you. I did see in your email, Megan, that you mentioned that the commissioner update would need to be moved to the beginning of the meeting. Should we move on to that now, or should we talk about the regular agenda item at 9:20, the BHAAC business?
I think it should be. We adjusted it. So if we follow the slides, the 9:20 is now the commissioner briefing. So we can move on to Jamie. Thank you.
Great. Turn it over to interim commissioner Michelle Barnes.
Thanks, Jamie. Thank you for chairing. I hope can you guys hear me all right? I'm seeing a yes from Jamie. I'm doing the computer and phone at the same time. I'm in a loud place, so I apologize. So it's nice to see everybody. I hope you had a great new year. A lot has been happening at BHA, so I want to give you a quick update, and then I'm happy to answer any questions. So I'm just going to kind of vomit a whole bunch of information, and then we can go through any questions. So one, I want to start with some great news. We have two new deputy commissioners at Behavioral Health Administration. Kelly Causey is on the call today, and you're going to hear from her in a little bit. She's our new deputy commissioner for engagement. And so Kelly, well, let me introduce you, and then when you do the presentation later, you can go into more detail. Kelly joins us from Colorado Children's Campaign, where she was the CEO for the last 7 or so years. And they're an advocacy organization that really focuses on the needs of young people and their families in the state of Colorado. They do this report. If you guys haven't seen it, Megan, maybe, or Jason, maybe this is an action item. We send it out to this group. It's called Kids Count. And it is like the Bible on what's going on with youth in the state of Colorado. They also do a lot of advocacy at the Capitol. Kelly is really well known among the legislators. In fact, her first week, we made her get up and be part of the joint budget committee meeting, which is unprecedented. So we brought in a real pro. Before that, she ran Mile High Youth Corps, which many of you know help a lot of disenfranchised young people enter the workforce through really amazing job training and support. She's actually Dr. Causey. She's got her PhD and has been with us just a little over a month. And it's like she's been here forever. In addition to being an expert on children, youth, and family, she's spent most of her career doing a lot of community engagement. So we're excited about that. And then I'll also add, she's got a lot of expertise on workforce. And as you know, BHA has a department on workforce that's trying to help build the behavioral health workforce in the state of Colorado. Because of Kelly's expertise, we've moved workforce to her department, as well as all of our work on children, youth, and family, which you'll hear more about as the day goes on. So, and yes, Tasha, it's Deputy Commissioner of Engagement. So we have basically 3 deputy commissioners. So Kelly is one of them, and she's been with us about a week. So you get to meet her later. The second one is Erin Wester, and she just joined us this week. It's her first week. And she joined us from Jefferson Center, where she was, I'm not giving the appropriate title. She's basically the CEO of Jefferson Center, and if not CEO, COO, head of administration. And if you guys know Jefferson Center, it's one of the largest community behavioral health centers in the state. They do everything from crisis service to safety net services to support for people experiencing homelessness to support for children, youth, and family. Jefferson Center covers kind of Jefferson West, I think, through Park County and Gilpin County, and probably got that wrong. And they've just merged with Well Power. So they're going to be the large community behavioral center for Denver, Jefferson, and West. Erin's also a former therapist. We've got another social worker in the house, has worked in the provider side for a long time. And as I said, this is her first week and she's jumped in. She's our deputy commissioner for systems and programs. So all the systems reform that we're doing will go under Erin. So if that makes sense, all the programmatic, all the safety net services, all of our care coordination, our licensing, our regulation will all go under Erin. So we have a third deputy commissioner. We're not calling him a deputy commissioner. It's called a, well, maybe we are deputy commissioner of administration. And that person's going to have the CFO function, HR, contracts, monitoring. They're also going to have a new function for BHA called strategic initiatives. We know our work is really complex. So we brought together a team of project managers, and these are people that like if they came into your life would look different because they know how to project manage things down to what's going to happen at 2:00 today and what's the outcome and what's going to happen and what the interrelatedness of them are. So we have a new team of project managers that are helping us really get our arms around particular statutory deliverables. So that position is just posting either tomorrow or Monday. Stephen Peng is acting in that capacity right now. So for those of you who know Stephen, we're moving that position from an interim to a permanent. So there's 3 senior leaders: engagement, which is Kelly Causey; systems and programs, which is Erin Wester; and a third to be hired, currently Stephen Peng. And Tosh, I saw if there's anything still on the website. I thought they'd all been taken down, but we'll check on that. Thanks for letting me know. And OBH is not a current department. You've just hit one of my hot buttons. For some reason, we can't seem to get OBH off of our postings. OBH has been gone for 2 years. It's BHA, but it's still listed on some of our materials as OBH. We are working on that. But no, so the 3 total deputy commissioners, 2 hired, 1 coming. And again, back to Megan and Jason, when that third position opens, could we send it to this group? You may know somebody who would be great for this position. So very exciting that the leadership team, one of the things we've been doing a lot of leadership training at BHA. And one of the things that the leadership team's consistently asking for is clarity. They want clarity on a lot of things. And one of them is leadership. And I don't think we have it, Megan, but if we could put up our new org chart or share it with this group in chat, the one that we shared at the all hands yesterday, we now have really good clarity on organization. I understand for you guys, and I definitely understand for the staff at BHA, having interim directors and this and your supervisor changes and this, it's just not healthy, and it doesn't allow us to have the level of accountability the organization has, but also just isn't great for career pathing or for making someone feel valued and invested in. So we have a really clear org chart right now, and we're hiring against it. And it involves a lot of internal promotions, which I'm excited about. We have several people where we still have openings in senior roles. We have people that have stepped up to do it on an interim basis, which is a great way to see if you want to try that promotion, see if you want to throw your name in. So very excited about where we are organizationally. On that note, that we are still looking for a permanent commissioner. I will say I'm on a hiring panel. I'm not the hiring manager. That is exclusively the governor. But I'm on one of the early round hiring panels for commissioners. And in the last 2 weeks, I think I've been in 4 or 5 interviews for people. So we're having some really good candidates come forward right now. A couple of them I'm particularly excited about that I think could do a great job. Now that I've been, here, I've been here for 9 months. Now that I've been here for 9 months, I really feel like this organization is ready for a permanent leader. They're smart people. We're organized. We're on track on all of our statutory requirements. We're doing amazing work. People are motivated. We had an all hands meeting yesterday and the energy was really good. And we talked about a lot of our key strategic initiatives, and people had great ideas and weighed in, and it was really participatory. So my only counsel to the governor has been, don't hire until you have somebody that's going to give this team the leader they deserve. So continuing to interview. But as I said, I am excited, particularly about a couple of the current candidates. So stay tuned on that. You know as much as I know at this point. Okay, a couple more things. BHA is just, I think you guys know, well, let me change tactics. We presented in December to the Joint Budget Committee. For those of you that aren't insiders at the Capitol, which I certainly wasn't before I took this job, once a year, every agency goes to the subcommittee of the legislators called the Joint Budget Committee. And they are, in my opinion, the most powerful committee on the legislature. They decide where the money goes. And it is a big deal. You spend weeks prepping for this presentation. We did dry runs. We did mock hearings. It is a big darn deal. And every agency does it, and BHA is no exception. And we went in and we talked about our budget requests for the next year. And interestingly, we're not asking for additional budget next year. We feel like with the ARPA grants we've got and with the money we've already been given that had longer spending authority, that we didn't need any incremental money this year. We just needed permission to continue to spend the ARPA money that was multi-year ARPA money. Like, don't roll it back. Let us keep having it and spend it back. But we did set it up that in the following year, we are going to have big budget requests based on some of the things we're seeing in rolling out the BOSSOs and the grievance system and the children and youth plan and safety net and care coordination, that we are going to have budget requests, but not this year. So we presented that to the JBC. We also went to the Joint Technology Committee, which is another committee of the legislature that does capital requests and technology requests. And we just asked to formally have an extension on our on our ability to spend money that we got through ARPA that has multi-year ability. So that was approved 4-2. So that's moving forward. So basically, the last month has been a lot of meetings with the legislature, and they have gone very, very well. If you want to hear how we presented BHA to the Joint Budget Committee, we can share that link. I'm really proud of the way we represented the organization and the people we serve. Coming up tomorrow is another legislative hearing called the SMART Act. And again, once a year, every agency goes to the legislature. This is a different group of people. This is a Human Services and Public Health Committee. And we talk about what we did last year and what we're going to do this coming year. So kind of think of it like a performance review, but you get 20 minutes up front to say, here's what we've done, here's what we're doing. And they have all kinds of things they want to know about, a lot of statutory requirements and spending things. That our hearing is tomorrow afternoon. And again, that's a public hearing. People can come down and listen to it. People can also listen to it online, and we can share that link. The reason why I'm inviting you to listen to one or the other, it's the way we tell the story about the BHA. Is something we would love feedback on. We don't have it finalized. We're getting better, we're getting closer, but we have not landed that plane. So we are very interested in any feedback from any single person on the on this council on how we could say it better, how could we say it differently, how can we make sure we're being inclusive. Like I said, we're just not there. The story's good, the story's not great. So would appreciate any feedback on that. All right, that's all good news. I think I want to talk about one of the things that the BHA does is we distribute a lot of grants. We do it through ARPA funds, but we also do it for regular general funds and other federal funds. We are overwhelmed with the number of grants we're distributing right now. We have 31 vacancies at BHA, 140 some employees, still, vacancies in the 30s. And so we're not fully staffed, and we are doing the work of an army with not full staff, and a lot of people that are very new. And so they're learning while they're doing, which is incredibly hard to do all of it at the same time. So we have had some snafus. We've had some little snafus. We've had some big snafus. I will tell you, our contracts and our program teams are working around the clock. I get emails in the middle of the night. I get contracts to review over the weekend. It's not that people aren't doing their very, very best. It's this unprecedented amount of ARPA money coming through a brand new agency that's still staffing itself, that's really pushed us to the limits. And I will say that team is the best team I've ever worked with on this kind of work. It's just an amazing lift. And Natasha, all the money has not been distributed. We still have a lot to distribute over the next 18 months. So some of our money is being distributed in year one, some's over multiple years. So there's huge amounts of money still coming, and everyone requires grant process thing, lots of people signing it, getting payments ready. It's an incredible lift. We did, and I want to just make a apology publicly to Hard Beauty. This last week, we had some delays on getting a grant payment out to them, and it caused them really incredible hardship as an organization. We know that our understaffing and our overwhelmed on the amount of money we count has real impact on real businesses and real humans. And we are doing the absolute best we can to get it out. We can ask for grace, we can ask for understanding, but it doesn't, that's fine, but it's not the same when it's your business and your grant is late, or your payment isn't coming when you need it to come to make payroll or to do what you need to do your business. So I'm going to ask this group. So I apologize to Raquel and her team for the hardship that caused to their organization. And if there's other, it was a bad week, but I will say Stephen Peng is a freaking hero. That man did things I've never seen done in state government to write that. And he's not on the call, but if anyone knows Stephen Peng, he is a superhero. But that's not how we should run our business. It shouldn't be dependent on gracious grantees, and it shouldn't be dependent on employees working, doing extraordinary things every day. We are working to get those systems put in place. If any of you hear about a grantee not getting their money in a timely manner, a problem with our system, I would really, really appreciate it if you'd let us know. And by us, maybe Megan, I don't want to volunteer you, but Megan can be the point person on that, because that's how we'll find the problems in the system and be able to correct them. So if you do hear about one, and Tasha, I saw you're also dependent on grant funding. If there is a problem, as soon as you know there might be a problem, let us know, because it'll help us improve the system improvement. So please partner with us on that.
Thank you, Michelle. And I had that conversation with Raquel as well, that I'm happy to anyone to reach out to me. I'm happy to be that point person. Want to know about these things as soon as possible. So thank you for bringing that up and asking me to be the point person. I'm on it.
Probably not the most fun, but it's super important. One of the BHA really does three things. We reform the system, we do contracts, and we distribute a lot of money. This year it's about $750 million. Just to give you the scale, that's about $750 million with a very small new staff. And then we regulate. And that's kind of the three buckets of what we do. The system reform is brand new. The contracting, the state's done for a long time, but never at the quantity we're doing it at now. And then the regulation, something we've done, but there's a lot more people to regulate. I saw that there was a question, but I can't see what it is.
Michelle,
it's a question from. Oh.
Yeah, I was just going to ask it, but Megan, feel free. One of the questions is, so for the federal rules for the NCSL ARPA funds, is
Yeah.
that you could actually spend through December 31st of 2026. In Colorado, I think the funds were supposed to be for the state were supposed to be spent by the end of 2024, December 30th. And I think because of the delays in getting the awardees and contracts out, like it really crunches the spend period, and therefore a lot of folks I think are scrambling to hire or to retain or to build the programs that were intended with these funds and proposals. So having a longer spend period to the match the federal rule, I think would be really helpful for everybody. So we're not scrambling.
Yeah, I completely agree. It's funny, we have two levels of spend authority. So the federal fund gives us the parameters around it, but then we have to have authority from the state legislature to spend it. So we continue to go back to them requesting authority to move spend out or move it. There's some federal ARPA funds that are more fluid and that are designated by the state. So we have to continue to talk to the legislature, even though the funds may be earmarked for certain things. That's why we had the JBC and the JTC hearing, is we have to go back and say, I know these are earmarked for, making it up, X. We'd like ability to continue to spend on that thing, but the state can reallocate some of those ARPA funds. So there's multiple phases in it. We're trying to get it out as fast as we can, just for that reason, that we want to give the people getting the funds as much time as possible to spend it. The hiring problems we're having, you're all having too. It's funny, I just read an article this morning about the hiring issues at hospitals, and it's critical there too. We are all struggling with hiring, and that's making it really hard to get the ARPA funds out for us as the recipient of them, but also for the people we're getting them to. So we are negotiating for as long as spend runway as we possibly can whenever we distribute them. If there's one that you hear of that doesn't have that, again, please let Megan know, and let's see if we can troubleshoot or get an exception from the legislature, or pull a rabbit out of the hat. We're willing to do what we have to do, or attempt to do what we have to do, to make sure people have the runway they need to spend the funds. Thank you for that. And then the last thing I wanted to mention is, I know this group's been very interested in our equity work. We continue to work with the Equity Project to help us frame our equity work. They put a team of employees together now that are working on that. They're under their direction. And if you don't know Equity Project, Google them. They're really top notch. And they're working with a team of employees to put together a survey and a group of focus groups that will help us understand the priorities for our equity work and help us. We owe a very detailed equity plan to the governor's office and the rest of our sister agencies by early summer. So I think the first version's probably due to them mid-March. So we're working really quickly to pull that together. On that point, the employees that have been selected, they applied not through me, but through the Equity Project to be part of this team, and they selected them. So it's really to give some checks and balance on leadership. We've also moved all of our equity work to be directly under Kelly Causey. She's also got a lot of experience on this, and we want to make sure everyone knows that equity is a high priority, not just equity, DEI, high priority for the organization. So it's moved to be under a deputy commissioner, just to show that senior level visibility. So I'm very excited about the work we're doing with them. And I think I've covered everything I had on my list. Does anyone have any questions for me? Or I'll be on, I can just kind of answer and chat as we go.
I have a quick question for you.
You bet.
Commissioner Barnes. I wonder if it would be beneficial to have the Equity Project do a presentation to the BHAAC at some point.
I think that would be a great idea. Can
Maybe
I
in a
just do a
future
quick
agenda.
show of hands? Would people be interested in that? I can see. Oh, I see lots of hands. Okay, thanks, Seth. Yeah, maybe we do that for March or the next meeting. Dr. Urge, if you haven't worked with them, I think they've worked with some of the counties. They're really fantastic. and love you to get a flavor for the work they're doing. And they're really trying to help us not just work on our internal equity, but how do we build that system equity into the new behavioral health system? So when we build it, we're thinking of, the profile of everyone in Colorado, not just, the biggest users of a system. Like, we're really looking at a system that'll work for everybody. And it's really hard to build that in because just not the way things have been done in the world up until now. And so we're doing it very, very differently. And it takes more time, and it takes more consideration, and it takes a lot more stakeholder engagement than some of the aggressive timelines that we have set out from the legislature. So very excited about their work. Megan, I'm back to you. If you're comfortable with that, maybe we ask Nita if they can, and Quill if they can come update us at the next meeting. Anyone else have a question?
I have it on my list.
Great.
Looks
I think,
like
I don't know.
we do have 2 questions for you. I think I saw Seth first and then Raquel.
Yeah, I just had a quick question. I know there's a lot of like spending and a lot of like things going on with the BHA and getting money out and stuff like that. I just wanted to know if there's been any focus specifically on HIV organizations that might be doing not just mental health care, but also things like needle exchange and stuff with substances, and trying to do recovery stuff with people out in the community, and if there's been any targeted funding for LGBT. Those are just some of the quick things I would like to know about.
Yeah, that was Seth, right? Thanks for that question, Seth. I'm gonna have to get back with you on specifics on that, but I know LGBTQ is considered a priority population, so absolutely on that. I do not believe HIV is in statute considered a priority diagnosis. The way the statute is not around the diagnosis of the person, but rather the population. So I don't know how much of our grant money has gone for that kind of work, but let's get back to you. That's a really interesting question. I just don't know the answer, but I do know LGBTQ is a priority.
Thank you, Raquel.
Yeah, I was just gonna say
Seth.
that there's mental health services at quite a few mental health centers who do specialize in HIV prevention and research, but they have therapists. The LGBT center on Colfax has therapists and stuff like that. Those are kind of the things of I know Mile High Behavioral Health does a lot with HIV positive people specifically, and Colorado Health Network has therapists and psychiatrists that they do. I just would like to know if they're expanding, getting funded, stuff like that.
Yeah, you're making me think. I know the public health Department of Public Health. Yeah, they do have direct funding for that, so we can look at what kind of funding they're doing and kind of an overlay of what we're doing and see what agencies are getting funded. Because the organizations you mentioned, I know I'm familiar with, but we'll get back to you, Seth. And if other people are interested in that question, we can send it to the whole council.
All right, thank you. That's all I had.
Yeah, thanks, Seth.
Okay, thank you, Seth. Raquel?
Yeah, Raquel Garcia. I am actually currently being funded by the BHA to am part of 5 leaders across the state of Colorado that were awarded an opportunity to master or kind of really dive into equitable behavioral health through the College of Behavioral Health. And so you've got 5 leaders that the BHA is actually funding to learn this work that I think would be valuable to bring in, mainly because we all sit in different regions of Colorado. So while the BHA is funding us, maybe you could actually also use us in this capacity. You've got a wonderful woman named Marnie in Boulder. You have someone else in the San Luis Valley, me out where I'm at. And so they did a really good job of doing some great regional work. And I think it would benefit the BHA to loop us back in We're all doing capstone projects on the region, so we might have some
Oh.
insights to offer that equitable group. Just a way to tie what you guys have funded back
Full circle.
into the work we're doing. You know what I mean, Michelle? That's my
Yeah,
idea.
Raquel, can I ask, in that, in those, I'm familiar with that program, in
Yep.
those scholarships or stipends or whatever it is we're doing, I think scholarship's the right word. Is there a expectation back to the recipients that they'd be willing to help? Not
No,
at this
there's
point?
not. There's not a
Okay.
requirement, but I know that like I'm doing some specific work regionally for my area, so we've got a
Okay.
lot of input there. And then you'll have different inputs from, I know one lady's in the San Luis Valley, and then you have the Boulder region too. I can't remember the other ones, but I just feel like this skill set, you know, to use it in the to use it and
Yeah.
bring it full circle would be a benefit.
I love that idea. I know.
Yeah. And I know
Kelly's on,
Catherine said in the chat that she's willing to volunteer. You know, I do a lot of equitable behavioral health work across the state. So even from a volunteer basis to make sure that sometimes also I do a lot of JEDI work across the country, and sometimes agencies are great, but if you don't have the people that live here that are in it and making sure that we actually use the services, like someone like Tasha we were talking about, then sometimes there's a disconnect, and I'm learning that now. If we're not touching services, then there's can still sometimes be a disconnect still in the DEI space when it comes to equitable behavioral health, because
Yeah.
I'm still, you know, actually seeing clients. So there's a very different experience that we can bring to the table. So just something to think about.
No, it's a great and I know Kelly's on. We'll follow up with you, and I'm sure someone at BHA knows who all those recipients are and see how we can pull them in. So thank you for the suggestion. That's great.
And it looks like we're running a little over time, but we want to make sure and hear from you, Robert. So if you go ahead and ask your question of Commissioner Barnes, and then we'll move on to the next agenda item.
Yeah, hi, how's it going?
Hi, Rob.
Rob Archuleta. Is the BHA looking at doing some education for communities just across the whole state? We have a lot of questions, a lot of you know, government agencies, and just for example, probation, parole, police that have had like such high turnover rates, judges, and talking about and educating, like from everything from involuntary commitments to emergency commitments to harm reduction to you know, the STIRT programs and what the BHA has going, because there are a lot of people using services that have never used it before. And it seems like there is some unclear language in some of the statutes.
Yeah.
So like, it's really hard to understand, like, what does an emergency commitment do? Like, how do you enforce that? Is it enforceable? By the way, you have a great emergency commitment and voluntary commitment team right now at the BHA.
Yeah, we do.
Best you've ever had.
I
But
agree.
still, there's a lot of education needed in the communities. And I was wondering, is the BHA doing that? Is that something that some of us can take on? You know, it just seems like there is a lot of confusion, and in times, like, even I said this in another meeting, like the BHA, like advocating for harm reduction at the same time as having, you know, involuntary commitments can send a conflicting message at times. And so, like, you know, educating the community on when it's necessary and when the other isn't, and how we manage both of them and find balance in it. So I just was curious if the BHA had a plan for education, just to communities.
Yeah, that's a great, I feel like you set me up on that, Rob, because then I get to talk about one of the cool things we're doing. We are working on what's called a learning management system at LMS. It's part of our workforce initiative that basically will be, picture it like an online university on a lot of the things, exactly the type of modules you just mentioned, like what's harm reduction, what's involuntary commitment, what does that mean, and translating it from state speak into what it would mean for a provider. So this learning management systems for providers, but also for credentialing. So we're using it for people who are in the behavioral health field, or in some cases more social work fields that want to get more experience, or medical field that want to get more experience on behavioral health. They can go in and take modules, add to their education base, and get certificates, which will help them get higher pay and be more qualified for promotional jobs. It's something BHA has been working on for about a year. We don't have a launch date. It'll go out sometime this spring. And as soon as I say that, someone's going to text and say it's June 1 or maybe it's March 1. But I believe it's a soft rollout that will start rolling out modules. We're doing it in collaboration with other providers. Like I know Ann Schutz is one of our providers on it to make sure the quality of the education that we're putting out is top notch. So if you have specific things, any of you that you think that you want to make sure would be in that learning management system, I'm just going to keep going back to you. We let Megan know, and we'll add it to the curriculum that they're developing. I know they have the first round of curriculum, and I believe, Rob, every single thing you mentioned is in the first round, but we can confirm that. And if there's other things, please let us know, because that can influence how we prioritize what gets done first. But I really feel like that's a great way to do two things. One, reduce administrative burden, because we're providing more information to people so you don't have to go figure it out yourself. And two, allow people to move up in the workforce because they can get credentialing and continuing ed, and it's free. So instead of having to go to a local provider and get that education and pay a couple $100 out of your pocket to get a certificate, you can get it free from the state. So really exciting part of our workforce development, but would love to hear from you on more of that. And Rob, sometime we'll have to have a debate on harm reduction. If you go over to the Capitol, those are fired up words. Lots of people have different views on that. So maybe we can have a coffee and talk about that one. And the last thing I wanted to mention on our equity that is on my notes, but I didn't say, one of the things that we've implemented at BHA, and it's now also being implemented at Department of Human Services, my home agency, is as we hired these deputy commissioners and a couple other senior roles, we've invited people from the advisory committee or the Family Voice Council to join those interview panels. And I have to be honest, it's been amazing. It's fantastic. And that is now going to be standard process for us on interviewing. And so you will be asked now and then if you want to, volunteer to join a panel. Please do if you want. I'd say Tasha's done it a couple times with us, and I think they had a really good experience and added a lot of value. So that's something, just know in the coming months, we're going to be asking more and more if people would be willing to volunteer some time to be on an interview panel. It's been fantastic. We also had Family Voice Council at CDHS do it, and really great pivot in terms of making sure voices of people with lived experience are at the table when we're making senior hiring decisions. So that's all I have for today. Thanks. I'll put it back to you, Jamie.
Thank you, Commissioner Barnes. A lot of good information. I think the discussion was really robust today. You're getting a volunteer in the chat to help with some of your hiring. And
okay.
I think with all the information you presented today, I think the biggest takeaway is Megan is the repository of all things that we have to share with the BHA. So Megan, good job.
Thank you. I'm really excited about this discussion that we've had with Interim Commissioner Barnes. And just so you all know, I did message Jamie that we were okay, that we were going over time and kind of moving into our BHAAC business piece, because I think all of these things that were coming up today with Commissioner Barnes were related to our BHAAC business and really important conversation. And I really wanted to respect that discussion and all of you, your input and your questions. This is what we need from you. And so thank you. Thank you so much for bringing so many of these things to our attention. And I'm excited about next steps on all of these things. Thank you, Interim Commissioner Barnes, for spending additional time on the briefing today and for your investment in all things behavioral health.
Very good. Thank you, Megan. Now we're going to move on to BHAAC business.
We can head over to the next slide, please. Okay, so a quick update on the group agreements. So next steps from our November meeting on the shared group agreements was that, which I want to thank Raquel Garcia for leading a really great discussion in November on our group agreements and the importance of ensuring psychological safety within this group. And to all of you for bringing it to my awareness that the group agreements had been created for you and not with you. We want all of these things to be created with you. And so with that being said, the next steps were for the BHAAC Executive Committee to get together and go through all of the input that you all shared in the November meeting. And the executive committee is a phenomenal group of individuals and did meet with me. There were 3 scheduled meetings, but unfortunately, due to different circumstances that came up for our members, we were not able to get everyone together to be able to go through these. And so we have our next BHAAC Executive Committee meeting next week, and we'll go through all of these and finalize them and email it out to all of you so you have some time to discuss it. And so when we have our March meeting, it will be updated with group agreements that you all have agreed on through email, and we can take a quick vote at that meeting. So just wanted to share that quick update with you. Any questions on that? Okay, next slide, please. Letters of commitment, a reminder that we are working on getting the letters of commitment finalized. You all had in the email that I sent out to you previously with all of the prep work. And again, I apologize that my emails and communication have so much in them, but I'm a big fan of oversharing with you all rather than undersharing. And so please feel free to reach out at any point with any questions, with anything that I share. And so there is an update in there on the letters of commitment that are also shared in that email. And so we would like to have all letters of commitment signed by the end of January. So by January 31st, we'd like to have all of those back at the very latest. The sooner the better. And you can reach out to Jason, Chelsea, as well as myself. Feel free to include both of us on the email, and we will put Jason's email again in the chat. But if you don't have it, just reach out to me and I will get it to Jason, and Jason will work with each of you. So wanted to remind you on those letters of commitment that you have 3 options. You can continue your current term, which started for many of you September of 2022. I know there's some variations. Some of you have informed me yours started in July. I think one of you informed me yours started in December. So there are some staggering timelines on those. But your start date to a 3-year term is what you are currently appointed under. And as a reminder, in statute, you do have an option because you are the inaugural BHAAC. You have an option of only serving a 2-year term should you choose. So whatever's in your best interest. If you want to continue your 3-year term, or if you want to continue on in your current term but modify it to a 2-year term, Jason will help you get those dates in those letters. And Jason will also help you with getting it signed. As he's been working with all of you on your invoices, Jason's been a phenomenal support to BHAAC, and shared with me that he's become quite passionate about this group. So Jason, we are grateful for your commitment and your support. Are there any questions about the letters of commitment?
Looks like we have 2 hands up, Megan, Tasha, and then Renee.
Okay. Go ahead, Tasha.
Okay. I have one question. In that letter of commitment, and the only reason I ask this is because this is brand new that got brought up. The part in the letter where it says that we forfeit our right to sue the BHA, why is that put in there?
That is, so Tasha, I know that you are on CDHS's Family Voice Council. And so we, in creating this, CDHS has put so much effort into their boards and councils. They're ahead of the BHA. The BHA, we're new. We're learning this as we go, and CDHS is a great support for us. And so that came directly from CDHS's letter of commitment. And I'm happy to connect with you with Chelsea, and we can dive further into that and provide more of an update if you would like to.
Okay. And also one more question on the 2-year terms. If it is 2-year terms, does that mean like on some of us where we start September, start July? If we started in July, would that end our term this July? So that would be 2 years, correct?
Yes, that is correct. Yes. And so if you started, same example, if you started in July and you want to do 3 years, it would end, the current term you're on would end in July of 25. And then one thing I wanted to add on to that is, as you all know, as you all learned in our last meeting, and I put a reminder in my communication to you as well, the BHA is starting our Family Voice Council. And so the recruitment for that will begin in February. And we are working to align efforts for BHAAC to fill BHAAC seats as well. We're aligning that same timeline with Chelsea and aligning some efforts there. And so I do want to be very clear with you all, in case there's any confusion, that if you choose, so you do have, your third option is to decide that this isn't for you, which I hope that none of you choose that option because you are all amazing and so important to our council. But if you do, we absolutely respect that also. And if you choose that option, you then have the opportunity to apply for BHA's Family Voice Council, but you are not guaranteed. It is still a fair recruitment process. And so you're not guaranteed a seat if you apply. I just want to be very clear and transparent so there's no confusion. And you cannot be on both. So wanted to reiterate that just one more time as well. And that is to allow as much opportunity as possible for more people to be involved with us. And so we made that decision that if you are already on a BHA advisory council, then you cannot be on the Family Voice Council as well. And then Renee, I see your hand. And I think that's who you had called on, Jamie, right? I just want to make sure I'm not missing anyone. Okay.
I was just curious, can we, with the letters, can we DocuSign, or does it need to be an official signature?
I believe DocuSign is what Jason is using.
It's actually through Adobe. So I will send you put your email address in there, and then I'll ask you to sign, and you'll sign it and you'll kick it back to me, and then I will forward it on to Megan or whatever instructions she gives me so that we can have these correctly filed. And it's the same thing with the invoices as well. It's an invitation to just go ahead and sign, and it will be either sent back to me or sent to Megan for her signature so we can go ahead and process those. It's really simple. All you need to do is just go in there and apply your signature, and then go ahead and send that out.
Thanks, Jason. Good question, Renee. We do have 2 questions in the chat, Megan. Oops, and I just lost them. I apologize. Cameron is confirming that the commitment letters were sent out. And yes, I believe they were, right, Megan, in the email?
Yes,
Yep.
they are in the email, Cameron. If you would like us to send it to you again, we are happy to do so.
Thank you. And then Nor wants to know if the issue with payments for sessions have been figured out. We would like clarification as to obtain compensation. Last time it took months. So can you talk about the payment?
Absolutely. Oh, sorry. I think Jason might have been chiming in. Jason has been phenomenal with helping to shore up that process. We continue to work with our fiscal team to ensure that everyone is getting compensated as efficiently as possible. And again, if you have any issues, if there's any delays, please reach out to me immediately, and I will work on ensuring that everything is cleared up with that. And then additionally, we are working on, as I had shared with you all before, really working on aligning all things within our councils and our boards at the BHA. And so this relates to Tasha's comment in the chat as well. With the compensation for Family Voice Council and BHAAC, we are working to align how we're compensating in that process. So I'm working with our fiscal team to shore that up so that we have the same compensation, the same equitable compensation for members of all of our councils. So thank you for always bringing this to our attention and for your patience as we build this out and align it. I'm also really excited for our boards and commissions position. It does, I believe it is still open actually, and it closes next week. So that's on our policy and legislative team. And that will be someone that can really work with all of our boards and councils. They will be working on all things with invoicing, bylaws, support for our councils and boards, and ensuring alignment across all of them. Thanks,
I just wanted to say, Megan, real quick on some of those. So they filter through a bunch of different groups, and then what happens is once it gets approved, a check is cut to someone. Unfortunately, due to the end of the year with the holidays and everything, that process just took a lot longer. And then when they are cut, they are sent through the United States Postal Service. So it's just a regular snail mail check is being cut that way. So just wanted to let you know that process does take a little bit of time. But once we go ahead and send that off to our payment email, then they start that process and get those checks cut out to you.
Thank you, Jason.
Thanks. Seth, you have a question?
Well, just like, I think I signed like an invoice like a month and a half ago with Jason. And like, I understand there's delays and stuff like that, but like, I was supposed to like receive a $300 check from like past sessions and stuff like that to get caught up. And it just hasn't arrived or even been in the mail. I have informed delivery for the mail, and I was just wondering if and when that's going to be sent out.
Seth, thank you for bringing that to our attention. I will connect with Jason this afternoon. Jason, if you can find some time on my calendar and add that to the agenda, we'll be right on that and get you an update.
Thank you for that, Megan. And thanks for the question, Seth. And Tasha, you have your hand up?
Tasha Conquer here. I just want to give a big shout out to Megan because when it came to payment, I'm getting ready to relocate, and that money was dependent on to secure my new residence. And I just want to give Megan and Jason a big, huge shout out because without you guys being so prompt on that, I wouldn't have been able to obtain this goal. So thank you so much for all your hard work and dedication. And I also want to let you guys know that it's exactly 45 days from when we sign the invoice till when we get our checks. So just let you know that it is the 45-day mark. Thank you.
Okay, I don't see any other hands, so let's move on to the next slide. I covered this a little bit talking about the letters, open positions for BHAAC. We do have several open positions, and that is why it is so important to get those letters signed to us so we know exactly by January 31st, I need to know exactly how many open positions that we have so that we can start our recruiting process and start moving forward with filling those seats. And with that being said, want to give a chair's update that we do want to wait until those seats are filled before we select a permanent chair. If we can align and everything goes as timely as possible, we are hoping to have appointed the open positions by the end of March. And so then at that time, I don't know if we'll be ready to vote for a chair at our March meeting. I think we'll have to kind of see where we're at with that. But that's why I wanted to have the chair for our March meeting already in place. And so we will be able to, following that timeline, we will vote for a chair and have our permanent chair run our May meeting, which I'm really excited about. And so wanted to share that update with you all. Caroline, I see your hand up.
Yes, I was just curious as to like, is it on the website? Like if people want to apply for being a part of the BHAAC in the future, is it on the website?
Yes. So I'm working with CDHS to align with their Family Voice Council recruitment. And so all of it will be on the website. It is not yet. Our recruitment process will start in February after I have all of the letters of commitment and know exactly how many seats that we have. But thank
Okay.
you. That's a fantastic question, Caroline.
No, thank you.
Tasha.
One more question about this. For the BHAAC, not FBC, but BHAAC, that's a governor of, or not governor, but commissioner appointed position. How is that going to work since it's commissioner appointed when it comes to hiring with that or appointing new things? How is that going to be different? How is it going to be different than when we started because it was picked by the commissioner? So how is that going to work?
I'm trying to make sure I understand your question. They are commissioner appointed, so we start the recruitment process, but they will be commission. Do you mean because we have an interim commissioner right now? Is that?
No, interim commissioner, however, that like commissioner. Just the way that the process was when we got selected to be a part of this thing. We didn't have any interviews. We just submitted our applications and then picked that way. How is this recruitment process going to be different than the original recruitment process is what I'm wanting to know.
That's a great question as well, Tasha. Let me look into, and maybe you and I can connect because I was not part of the original process. And so I can connect with you and look into what that process is and then give you an update on what the differences will be. And I am happy. I will share that update. You all know I will. I will send you an email with an update on that to clarify it for everyone. And I do want to be mindful that your break started at 10:15, but I see Seth's hand up. So Seth, do you want to ask your question quickly?
Yeah, it's just a quick thing. One thing about the original process of applying for the BHAAC was, and I think this was vital for me getting selected, was that I had 2 professional references at work that were therapists and supervisors submit letters of recommendation for me. And I think that the way they were written helped me get on the council with the former commissioner. And I would just highly encourage that part of the process still be like letters of recommendation, like 2 or 3 or something, because that way you get a really idea of, you know, who's being selected and who's being referred and stuff.
Thank you, Seth.
Fantastic. We are a little behind on taking our break, but we will take the full 15 minutes, if that's okay with you, Megan. So if we can come back here, if I can do the math correctly, at 10:33, and we can reconvene with the agenda. Thank you.
Great. Thank you.
Jason, you might want to unshare your screen as we're now able to see your entire screen.
Hey, Jason or somebody, can I just get a check that my microphone is working? Oh, I see some nods. Thank you, ma'am.
Hi, everyone. Welcome back from break. Hope everybody got up, stretched, got some water, maybe a little snack, looked outside. All right, Megan, are we ready to get started back up?
Yes, Jamie, I think we should, since we're right at 10:33. And I want to keep us on task. Thank you.
Perfect. All right, we're on to the BHA legislative update.
Okay, as I warned you all at the beginning, I will be providing your legislative update today, as our policy team is all stressed or stretched in multiple directions and double committed at different times. And so they gave me some information to share with you all. I do expect that you are going to have questions that I will not be able to answer. And so please feel free to email me any of those questions and I will get the answers or connect you to the people that can answer them. So with that, next slide, please. The 2023 Colorado legislative session convened on January 10th. The BHA presented at the Joint Technology Committee on requesting an additional year to complete our technology systems. Ashley Darnell and Commissioner Barnes did an amazing job, and our request was approved 4-2. So that's really exciting news, and they really, truly did an amazing job. Next slide, please. So here listed on your screen, I will also read them out loud, is the behavioral health related bills that have been introduced this legislative session. So SB 24-001 is to continue mental health services program. And we are really excited to be supporting this bill that continues iMatter. And for those of you that don't know what iMatter is, it offers free therapy sessions to youth. And is a phenomenal program. So if you have any questions, feel free to reach out and I will connect you to the program manager that can answer all of your questions on that. Senate Bill 24-047 is prevention of substance use disorders. Senate Bill 24-048 is substance use disorder recovery. House Bill 24-1019 is the crisis resolution team program. House Bill 24-1038 is the high acuity crisis for children and youth bill. House Bill 24-1045 is the bill for treatment for substance use disorders. And House Bill 24-1079 person detained in jail on emergency commitment. So I imagine you may have questions on details on these bills. And so I can connect you with the correct people if you reach out to me with those questions. And I see Commissioner Barnes has a hand up. Go ahead, Commissioner Barnes.
Yeah, thanks, Megan. I thought about since I'd legislators, can I just point out two of these? The I Matter bill is got a lot of support for it. And it's the reason why it's such a big deal this year is every year it's a temporary program. And so we don't actually fix it. So like it's running like a well-oiled machine. It's just temporary, temporary, temporary. And this program gives up to 6 free behavioral health sessions, mental health sessions for our young people in the state. It is wildly successful. It's the only one in the country. We have about 8,000 kids every year that take advantage of it. It is helping address mental health conditions. So a lot of good support, particularly Michelson Janae on that one. But I also want to pull out the high acuity crisis for children and youth. I know quite a few of you know about some of the challenges we're having right now with not enough continuum of care for our young people. And so we have kids stuck in the child welfare system, sleeping in the office of their caseworker. We have children that are unsafe at home because we don't have a placement for them. We have children that are sitting in hospital, too high level of care, need to bear. This bill is a collaborative effort to really start to address that. So if all of these bills are very important, but if I could ask you guys to really pay some particular focus to this high acuity crisis for children and youth, it's huge. And it will have such a huge impact. And as the team this afternoon goes through what's going on with the children and youth plan, I think you'll understand that. But if you don't know this one, write the bill number down, and we'd really appreciate any support on that. So that's what I wanted to add, Megan.
Thank you.
Looks like Seth has a question.
Yeah, Seth Watkins. I'm just kind of like perplexed of, you know, SB 24-047 and SB 24-048. Like, I understand the difference between prevention and recovery, but like, do these bills mirror each other to like affect change, or do they like compete against each other? Because one people want prevention and other people prefer the word recovery. I'm just kind of baffled by like what's in both of those.
Thank you, Seth. I will follow up with you. I'll get some more information for you. Oh, and Commissioner Barnes' hands is up. Sorry.
Commissioner Barnes, did you have another question, or did you forget to take your hand down? Or another statement? I think maybe she forgot to take her hand down. But I did want to mention that you probably completed this slide before another behavioral health bill was introduced, and that is Senate Bill 059, the Children's Behavioral Health Statewide System of Care Bill. We're really excited about this bill. This, in addition to 1038, as Commissioner Barnes mentioned, the high acuity crisis for children and youth, 059, the Children's Behavioral Health Statewide System of Care, came out of the Child Welfare Interim Committee that met over the summer. And there's been a lot of work happening around 059. So a lot of work still happening. We're having discussions all the time regarding how this bill can really impact behavioral health for children and youth in the state of Colorado. So I encourage you also, if you could add it to the list, Megan, that would be great. And encourage you to please go out and read it. And, you know, just really excited to see where that bill goes as well. And Seth, you have your hand up.
Hi, Seth Watkins. Just a quick question. When I hear the terms child and youth, I know the age of child, but what is the age max of youth? Like, because I work for a program that focuses on first episode psychosis in youth 15 to 29. I know 29 is like an adult, but like, is age 24 still considered a young person or youth? Or what is youth? And because there's a lot of LGBT youth who are like fighting homelessness and don't have places to go, and they're just starting their transition if they're transitioning because they come here from another state that doesn't allow it. So I'm just kind of like, what is the definition of youth in the state for all of these bills and purposes?
Megan.
Thank you, Seth. Great question. And we are fully aware that youth is defined in different ways depending on different programs. So transition age youth, I have seen transition age youth be up to the age of 24. I have also seen it be up to the age of 26. I see Nora's comment of being 25. The program that you're speaking about for first episode psychosis serves youth and young adults up to the age of 29, and so that's looped in there. And so I think, yes, there is some variation, and I think that when we look at different bills and we look at different programs, it is important to look at the age that is mentioned because it can vary across those. And I did want to say also, Jamie, thank you so much for bringing up the system of care bill. I will absolutely add it to the list. Thank you for the introduction in it and talking a little bit more about that bill as well. I appreciate it.
Thanks, Megan. Tasha has a question in the chat. What is defined as youth in statute? I don't know if anybody knows that off the top, but if not, probably something we can follow up with as well. But I agree with all the comments. Youth is defined very differently based on the different programs that are administered.
Tasha, I'll get an answer for you, and I have a whole page of notes. So you all can expect a lengthy email as follow-up from this meeting with some answers. And then we can move on to the next slide. You can follow the legislative process for any bills by searching the bill number on the General Assembly's website. And feel free to reach out to me with any questions. When I send the follow-up email, I will include a link to that website so that you all have it.
Perfect. Any other questions or comments on the legislative update that Megan so wonderfully presented for her team? A lot more discussion to come on all of the great bills that are being considered this session. Okay, I think we're ready to move on the agenda, and next we have the Child and Youth Behavioral Health Implementation Plan. I see Matt Holtman. Maybe he's presenting today.
Yes, Matt and I are going to tag team it, Jamie.
Oh, all right, Kelly, yay. All right, take it away, Kelly and Matt.
Thank you. I'll kick us off. I wanted to just take a minute to say how much I'm enjoying getting to know you all. I had some time with the executive committee earlier this week, and I'm just so impressed by all of you and really appreciate your service on this council. And I know many of you are involved in lots of different ways in your communities and maybe with the state in different ways. So I just wanted to personally thank you for that. I wanted to share just a little bit of my background. Michelle, thanks for your kind words. And you shared a bit about my work with the Colorado Children's Campaign, with Mile High Youth Corps, both of those very informative. Some of you might be like me. I've had like 2 jobs in 25 years. So this is my 3rd, but was deeply invested with both of those organizations. And for this engagement role, was really excited to come to the BHA for the first time to work with the state. I've been on the outside as a direct service provider of young people on the outside as an advocate, and now to be within the state to be able to make a big change and the kind of system reform that we're needing for people in our state. And so it was exciting for me to jump in particular for the Deputy Commissioner of Engagement. The areas that fall under my work, you'll meet our other deputy commissioners in future meetings. But in my purview is the policy work, and Megan, you did a great job. The team would be proud. Policy, our communications, our community engagement, and so things like this and how we are out in communities and having folks inform our work. Also, the equity work and in workforce. And I'll just comment a little bit. We can spend more time on the workforce piece too. It's how we're building our talent pipeline in behavioral health. And the piece around equity, all of this very exciting for me. I've devoted a lot of work on my own personal journey and through the prior organizations that I worked for in doing the EDI work. Also have done race caucusing, and I'm involved in affinity groups. And so just to share with you all how important it is for me, but also how I know that all of this work informed by community and with an equity lens is what gets us to having really good systems and removing barriers for those who have the most in front of them. So I'm excited about all of this and eager to share one piece of our work, which is this youth plan. And so I'll kick us up a little bit with the youth plan. Some of you have been involved in the stakeholdering leading up to this, so forgive me if it's repetitive. If you've all been deep in the work, you can also help contribute to our conversation around this. And so oh, great, I'm looking at the agenda on screen. And so the work has been informed early on from the original Behavioral Health Task Force. There was a subcommittee on children and youth, lots of stakeholdering, community engagement. And so this was informed by all of it. What we heard from Coloradans, and you all probably among them, is that the system is fragmented. We need to have that be smoother. It's also hard to know who's accountable to make sure it's working well and improving, and that's the BHA's role. Another piece that we heard loud and clear is that we can't assume that young people experience our systems the way adults do. So we have to center child, we have to center youth. Seth, you asked a great question around the age. This plan reflects up to age 21. And so we're wanting to take that feedback, and this plan is one step in a process to help us make sure that our systems work well for children and young people. And so there were multiple agencies. We have a slide on it to show you how many. There are multiple state agencies that were involved in creating this plan, again, informed by the prior work and community engagement beforehand, that worked collaboratively to work on this plan. And it includes almost 100 action items, clearly defined state department by state department, who's doing what to help further the work. The group also pulled from those 100 action items and said, what are our top 6 immediate priorities right now? The plan covers a 5-year span, but we know we need to be doing these things today, tomorrow, get this going. And so that's where the action items and these priorities that we've highlighted come into play, that the public will be able to see what are the steps we're taking right now. We can't do all 96 action items all today and have them done today. But what we're going to show is, and what you should be able to see in it, is that we are taking action. And the 6 immediate priorities are for right now this year. And so we're going to highlight for you, we're not going to go into action item by action item, but it's on our website. I believe it was sent out to committee members. We have an executive summary. We also have on the website the full 120-page document. And then we shared the slides that were shared with community groups when we were doing stakeholding prior to releasing it. So all of this information is available to you. We're happy to answer questions. We're excited about it. And then I'll reiterate again, it's a first step and we're on our way, and we're going to be adjusting as we go. So when things are working, great. And when things aren't, we're going to correct for that and make adjustments. We're also going to continue to put an equity lens on this work. So there are some things in which it's equal. all kids, all children and youth deserve certain things. The access, the affordability, high quality care in our efforts to say no wrong door. And so all children and youth deserve that, and their caregivers and how would they use the system. But there are also things that need to be equitable in the way of deeper investment and strategies related to populations that have the most barriers in front of them in our systems. And so we're going to continue to work on that too, as this plan unfolds and as we collaborate with these departments to make all of that happen. So I'll just pause there and just see if there are any questions, but then I'm going to hand it over to Matt, and he's going to walk through high level, the priorities, the action items, how, when you go into the document, what you can expect to see.
Kelly, it looks like Seth has a question.
Great.
Hi, Seth Watkins. So I'm hoping that in the Child Youth Family Plan, there is situations where there's planning or prevention or education or something about school bullying, because a lot of young people with peer pressure and stress at home and stress in the classroom, they kind of like, a lot of it, like even people that face discrimination or racism starts by being bullied at like no matter what age, and it continues like to progress throughout the school year. I remember when I was in middle and high school, like I got bullied all the time for being different and being, you know, poor and being like just a different person. So like it affected my whole life, like and it caused a big part of my lived experience. So it's like I learned how to adapt and deal with, you know, trauma and fear and stuff like that. But it's just kind of like, when can we stop it at a young age? Like, is there anything in the plan about bullying?
Seth, thank you so much for raising that. I'm sorry that that was your experience through school, and yet shared by so many people. And so thanks for raising that. What I'll do is let Matt walk through the key items and all of that. And you'll see the Colorado Department of Education was very involved in this. And you will be able to walk through and see, Matt, off the top of my head, I don't know if bullying in particular was named within it, but Seth, we can check on that and it's available and you can look through that too. But I do know that they're very aware of the impact of bullying on well-being. They're also very aware of social media impacts on that. And so we will definitely keep an eye on that as we walk through the presentation. And then we can also circle back to you, Seth, and highlight that in particular.
Okay, thank you.
Bet. Any other questions before I hand it off to Matt? Okay, we'll keep an eye on that in the chat. So Matt, I'm going to turn it over to you.
Outstanding. Thank you, Kelly. I appreciate it. I know some of you and some of you are meeting for the first time. So good afternoon. Matt Holtman. I am the Intergovernmental Liaison for Children and Youth, and very excited about this plan. I was able to put in chat the link to the plan online. Seth, you'll take a look at, I think, page 23, page 24 in there, there's a whole section on schools, right? So while the plan in itself doesn't indicate only bullying, it really is how do we work with and support behavioral health access and quality within schools. Okay, so, and please know, I wanna make sure as we go through the slides today, and Jason, if you can hit the next one, please, that I leave plenty of time for questions, comments, concerns, right now in real time. Also know the last slide is Kelly's email and my email. What tends to happen, at least to me, is at the end of these presentations, I have a lot of stuff going on and I can't articulate it, and I definitely can an hour or two later, right? And so as questions come up, as things come up, please feel free to email me. I'm happy to do that. So if you take a look here at all the amazing people that were involved in drafting this plan. And again, so this really came out of the Behavioral Health Task Force, the Children's Subcommittee of that. And those groups came together and had a very comprehensive list of things that they believed if we did these recommendations, we would improve child and youth behavioral health across Colorado. This plan is putting action to those recommendations, right? The recommendations are very important and they're so broad and they're so big, and somebody needs to do a thing or two things, or like Kelly said, 96 things, right, to begin to address these recommendations. Next slide, please, Jason. So one of the pieces that we really want to lean into is, you know, the creation of the BHA and all of that, is to acknowledge the amazing work that's already happening across systems and across agencies in Colorado. So this is not comprehensive by any means, but just an idea of some of the departments and meetings or councils that are already existing, doing incredible work around behavioral health for children and youth. And what BHA's responsibility is to then take all of that and help consolidate it and help focus it and help, you know, facilitate collaboration across all of these departments so that our work is aligned. So it's not siloed. Also a housekeeping piece just for me. If there's a question, comment along the way, feel free to raise your hand. Happy to take them as we go. I'm also notorious for forgetting questions as we go. So if you haven't, I'm happy to do that. Next slide, please, Jason. So we spend much more time in the full plan, which is on that website, which is 111 pages, really getting into the overview. I think what's important is this plan is not the end all be all, right? Based on the feedback from state agencies, SMEs within the state, subject matter experts, sorry for acronyms, for doing these programs and things like iMatter or things like Momentum or things, all these incredible programs, due to their feedback, due to the community's feedback and other department feedback along the way, we'll have another iteration of this plan next year, right? Hoping to not only work with the continued new gaps that are identified, right, but make sure we lean into our strengths as we go and make sure we're addressing the most pertinent issues as we go along. So I just want to call that out. Like, as you read this, if you do read the 111 pages, don't go, well, that's all they're going to do for 5 years. There's a lot in there, but I want people to know that there's opportunities to take your feedback even right now and move that forward. So that's one. The other piece is we will highlight for this meeting for right now, a lot of the BHA efforts. And as the previous slide indicates, there's 7 different departments across the state and community members and counties who helped to draft these things. This didn't happen, again, by accident. This didn't happen in a silo. And this is work that people have already committed to begin doing. And some of it has already started, right? So again, we weren't waiting for this plan to be released last Monday to begin doing some of this. We began to really, some of these pieces have been going on for a little bit. So, but our job is to focus them. Next slide, please, sir. This is, if this plan is successful, if we do a good job, we have done this, right? We have increased access and increased the quality of behavioral health care for the whole person and well-being across Colorado for all children and youth. So that's what we're trying to do. If successful, that's what it's all about. It really is the comprehensive continuum behavioral health services, not just things BHA directly controls or BHA directly oversees. I know Kelly hit on a few of these and Megan did earlier on too, on workforce development, on accountability and oversight for quality behavioral health. These are all built into it, and these are all really important components of the plan. Next slide, Jason. So while it is a multi-department and multi-system effort, BHA absolutely has the leading role in this. We definitely have a leadership piece. The biggest piece that I see is creating the structure for governance to ensure that all the incredible work happening right now continues to happen, and all the work that needs to occur gets started, and then all of that gets aligned in a way that's digestible, that is actionable. Right. We'll talk early in one of the immediate priorities on creating a governance style or system, or how do we report these pieces out. And there are so many existing groups, committees out there doing this good work. And if they're all doing 2 or 3 or 4 recommendations a year, and there's 20 or 30 groups across the state, that is a lot of information for us to give to, Commissioner Barnes to talk with our governor about and saying, here's 140 recommendations. So how do we focus that to the most impactful 2 or 3 or 4 this year, whatever that would be, to kind of begin moving that needle. All right, so what we did is in this 111 pages, we really broke it down to, yeah, you can go to the next slide. Thanks, Jason.
Hey, Matt.
Yes.
Sorry, I don't want to just jump in. You're flowing. You're doing great. I
I didn't
apologize.
see your hand,
for
Jamie.
your
No, you're
flow.
great. Yeah.
We do have a question in the chat, and it's in
Oh, sorry.
regards to a statement that was made about a lawsuit. And so there's a question asking you to talk about the lawsuit a little bit. So I don't know if you want to do that now or if you want to do it later, but I wanted to alert you to that so
Thank
that
you. And I had one chat up and not this chat for this meeting, right? The ADHD in me trying to navigate all these screens. Tasha, absolutely. I will answer that question. And we have a whole priority exactly on that because it's critically important. So if I miss it and don't answer your question, raise your hand. I'll try and find it. These are our 6. So we have 2 on this slide, 4 on the next slide. But the way this presentation really is organized is I'll go through the 6 kind of high level real quick, and then I'll break down each one, leaving, again, plenty of time for questions and comments. So first and foremost is creating the governance structure, like I just said, within BHA to take all of that current information from committees and groups, et cetera, and consolidate that. To bring it into something that our behavioral health interagency council at the state level can begin either funding or legislation, or what are those next steps that we can show impact the most or broadest or highest acuity behavioral health needs in the state, whatever that might be, right? But have support for that. We do need to spend probably additional attention on our juvenile justice youth and our school-based behavioral health youth. Those are 2 that that we have called out in the plan. We do recognize that there are some existing committees on these or groups meeting on this. We may want to lean into them in a different way, but we want to just call those groups of kiddos out, understanding that their needs might be different from the general population. So number 2, this shouldn't surprise anybody, but our youth with high acuity behavioral health needs. This is an immediate priority. This is something that we at the state need to begin addressing in a focused and dedicated way. Some of these efforts you see here are already existing and already moving. Crisis resolution teams are already up and running, right? But you'll see in the next slides where there's tasks to expand or to assess what that could look like statewide. Standardized assessments really increase and create intensive care coordination for our youth across the state. And you see some of the other ones. None is more important than any other one, but one that just hits home for us for me is to incentivize residential providers to take youth with the highest acuity behaviors in Colorado. Let's try and keep Colorado kids in Colorado and not send them out of state if we can. So how do we do that? But how do we make sure we have the right services to meet the needs of those kiddos here also? Next slide, please, Jason. Here's your lawsuit number 4 here, Tasha. We'll get there. So create a policy that increases the investment and promotion of our prevention efforts. So that's number 3. Number 2 spends so much time talking about our youth with high acuity behavioral health needs. It's critical that we focus on these youth. These youth take a lot of time. They're very complex. There's multi-systems involved, right? This is the other end of that spectrum. How do we keep our youth and kids from getting there? What can we put in preventative ways? So this is a huge partnership with public health, child welfare, in making sure that we have sustainable funding for this and sustainable programs for our prevention, so that if there's something that can be addressed at a much lower level, so that youth never has to end up experiencing high acuity needs because either support or services have been put in much earlier. The lawsuit is number 4. If folks are not familiar with it, okay. I feel like it's kind of been out there for a minute. See, this is our HICPUF partners and in a lawsuit with those with them. This is, but as I talk about it, it is not just HICPUF doing, that's, I think, how it may have been handled in the past, right? A siloed approach, a single department, and handling the concerns within that department. And there's nothing wrong with it, except there's so many pieces across the state in which we can help and support HICPUF as they address the needs of this lawsuit. And again, we'll break that down, but I think it's really important to know that we're partnering on all of these things. Number 5 is the support of ACC 3.0. If people don't know what that is, again, excuse me, it's the Accountable Care Collaborative. So this is how our Medicaid or our RAIs are broken up in Colorado, right? There's currently 7 of them. I will also throw this in chat too. So there's a whole website for ACC 3.0. If you want to spend the time, there's a lot to get into. So I just threw it in chat for some folks, and then we'll make sure everybody can see it. But it is really helping and aligning that work, right? Again, that's in general, that's a HICPUF process, and BHA can really be supportive along the way as we do that. Lastly is the successful rollout of our BASO system. So aligning and creating a system that fits with our non-Medicaid kiddos also, right? So how do we align behavioral health, substance use treatment in a way where we can eliminate as much administrative costs and really focus on bringing new providers to the table, new menus of services, and making sure that the quality of those services are at the highest possible. So those are the 6. Before I get into a little bit more details at each one, questions, comments, or concerns? Mr. Seth?
Hi, Seth Watkins. So I understand, like, I believe it was number 3 about prevention efforts. And as someone who has lived with schizoaffective disorder and a lot of other diagnoses, one thing that I and my clients who also are first episode psychosis deal with is people not fully understanding like what the diagnoses really are. It's like not every schizophrenic is trying to shoot up a school. Like, most schizophrenics are very docile and peaceful and isolatory, and people, like the general public, doesn't know, like there's a lack of education and a huge stigma for people with schizophrenia or first episode psychosis. People, like, I have clients that was in a psychotic episode, went to an ex-girlfriend's house, and basically ended up in jail, and and they were like in a psychotic episode, and it's like that's where they were taken instead of like being taken to like a facility to handle their mental health, and they were possibly facing charges and stuff like that. And it's just like, it doesn't excuse the person's behavior or what they did, but like it's kind of like common in a state of psychosis to do things that you normally wouldn't do because you feel an urgency that you have to do something to save someone or stop a bomb blowing up, or like being tracked by the CIA, stuff like that. And like there needs to be more, like I've seen on Facebook, the website RPath commercials and stuff like that, but I haven't seen anything specifically targeting psychosis and prevention and education, not just at like for adults, but also in the schools, like just kind of like letting people know that their friends who are in high school who experience first episode psychosis and go to the hospital for the first time, that doesn't mean that they're crazy or that they don't have an ability to go to school or achieve anything. So I'm just kind of like, because we catch them at first episode psychosis out of the hospital, and they stay with our program for like 5 to 6 years, but then they transition to an adult program like ACT or something. And it's just like catching them at the young age and getting them involved with programs and mental health programs and getting them when they're young, especially at 15 or 16, helps keep them from doing things like school shootings and anything else people blame schizophrenics for. And I just think there should be a lot of education financially promoting prevention of like an education of like this stigma.
Yeah, thank you, Seth.
That's it.
No, that's not. There's a lot to unpack there. And I don't know that we've fully flushed out all of those pieces. I definitely know our partnership with public health is exactly that. It's an informational piece and an educational campaign, but we have to. Those details have not been worked out. So I appreciate that, and that feedback will be taken because I agree. And there was two other hands, and I forget who was first. So if somebody else knows, please help me.
Yes, it was Renee and then Robert. So go ahead, Renee.
Thank you, Jamie.
Okay, so I have just two quick questions, or one. The first one's a comment. When I was reading through, I did not complete it. I did not have time. But what I've read thus far, there were a couple times that it said affordable care collaborative, not accountable care collaborative. So I just wanted to point that out, that might want to double check that those are all correct, rather than not saying affordable. And then the other thing is, how many youth were involved in preparing this as stakeholders?
Yeah, people with lived experience and what that looked like. I was not at BHA when this was created. I do know there was a lived experience group, and I don't know what youth, like the ages of those folks with lived experience was, Renee. So I can't answer that, but I do know it was not done solely by state employees.
Matt, I can add to that a little bit. That this work started with the Children's Subcommittee of the Behavioral Health Task Force, and they did robust stakeholdering to inform their recommendations that formed the implementation plan, if that helps answer your question.
It helps. I have some real concerns with a couple of areas within this, and I can wait till we get to those sections in more depth. Because I know in rural areas, things are very different. And what the youth are sharing is very different than what is in this plan. So I can go into it now, or I can wait till we get to certain areas.
Yeah, let's see if the following slides help shed any light on that, Renee. And if not, then we can get into it then. That's totally fine.
Okay, yeah. Great, thanks.
No, I appreciate it. Robert.
Sorry, I was trying to unmute. So one of the things I was just going to say, back to what Seth was asking, is I've been a prevention educator in the state of Colorado for most of my career. And I was looking at it as we were talking, and some of the stuff that some of the issues we're talking about, we also have to remember that the schools are the gatekeepers to when we go in and when we talk about this. And so I've been doing evidence-based curriculum, life skills, bottom-end education in schools all across the state, and it's not always welcomed. Do you know what I mean? Like, where do they fit it in? Because a lot of the times when we're doing prevention education, we're taking it out of gym and then everybody's mad, or we're taking it out of music and art. So I just wanted to point out, like, even if we have the best laid plan, they're also still getting the schools on board with this. What are the parents okay with? What are we doing? Like, one of the things we work on is like using prevention education, like we do critical thinking, communication, self-esteem. We're not educating on drugs and alcohol. So I just wanted to point out that even the best, even the most well laid out plan, there still has to be buy-in from the schools and the districts, because we know I have a C Corps grant now too, and we're still trying to get people on board with us teaching prevention education in their school, because they don't have the time or the room for us. So I think that also needs to just be taken into consideration, that it's not always on us. I've been doing this since OBH, and sometimes the doors are shut, sometimes the doors are open, sometimes they're reactive, which is the opposite of prevention. So I just wanted to point that out, that it's also, what are the schools willing to address and talk about?
Yeah, thanks for pointing that out, Robert. And by no means do I feel like, or do we feel like that, you know, if we just do the things on the plan, that A, it's going to go smoothly, and B, it's the secret to everything, right? I not assuming that at all. You can jump to the next slide too, Jason. I definitely think there's going to be work. But I want to make sure that this is just the start, right? For sure. So this is the start, and we definitely have buy-in from the departments and the state departments at this. And I totally agree with a couple of points already, that local buy-in may look different and local access may look different. So again, I'm not going to read all the words on the slides that's here. You have access to them. The plan is far more in depth if we need it. But what these slides do, I think, is really important, is it calls out kind of the lead agencies doing this work. Now, immediate priority one is all BHA, right? We definitely need some support from across other agencies, but it's BHA led, right? We need to stand up this reporting structure, the governance structure. We need to make sure that we have people, we have full inclusion in these groups, not just the ones BHA has control over, you know, meaning it's a chaired group or a group that we're having, but all of the groups. And you'll see on the next slide, Jason, there's a kind of a high level list of these. So you'll see on my left, I'm hoping it's your left also, that our BHA run groups and committees. So these are the ones we have direct control over. We can dictate membership and those things, and how the reporting structure goes, and how many recommendations they have, and those types of things. What we need to create is this Children and Youth Behavioral Health Implementation Committee, right? We don't have that yet. We'll have to kind of figure out what that is, what that looks like, who that can and should be. And then the groups outside, how do we integrate ourselves to not create an additional layer or burden, but integrate ourselves in a way to these existing groups to make sure that their recommendations or their voices are heard around children and youth behavioral health, and we're able to consolidate them to our commissioner, so that our commissioner can go to the statewide behavioral health interagency council and say what are the most, or advocate for the most impactful changes we need in Colorado. Whether, again, that's legislative changes or funding changes or what that could look like. So this one is this one's BHA, right? This is, this is Kelly, this is Megan, this is myself, right? So that's who's doing a lot of this stuff. Next slide, please. This one, I just highlighted a couple items here that, again, the BHA has focus, not that we are not included in any of them, right? But I just wanted to call our attention to kind of some of these that we have direct focus over, you know, and this, where this group can be, you know, helpful as we see these things, or if you're in groups where some of these are talked about, we would love that input, that feedback, that inclusion. So CRT, crisis resolution teams, they're out there, they're moving, they're in 17 counties. They have no wait list from what my understanding. And how do we increase the awareness, the public awareness in our in the community for what that looks like, so we can make those referrals if we need to make those referrals? And then and just look at expanding what that, the population which CRT can and maybe should handle statewide. What could that look like? What's the cost there? And not just mean cost in dollars, but staffing, et cetera. Like, how could we make that work? So analyzing that's all part of that one piece. Standardized assessments is, I think a lot of people are aware, standardized assessments for our high acuity youth, our youth with high acuity behavioral health needs, our youth entering residential treatment, our intensive in-home programs. The assessments which are required to get into those programs or be accepted can change, whether you have Medicaid or private insurance, or who has custody of these kiddos, right? All of these can change the process, and what we're hoping to do is standardize the process. So whoever has custody, wherever the kids are located, it's the same assessment, right? Or group of assessments that those kiddos are getting. Right now, the CANS, if anybody's doing CANS work, that's one of the focuses of this. And then the last one on this slide I'll just call attention to is increase the engagements with folks outside of state departments. What standardized assessments are they using, whether it's hospitals or somebody else, again, so we can show change, we can show quality of care, we can promote and encourage programs or system modalities that have the best rates of success. So there's way more on the slide than that, but I see a hand. Robert?
Sorry, I forgot to put it down.
Oh, no worries.
I have a question, Matt.
Yes, Jamie.
For number 2, the assess need and increase awareness of crisis resolution teams. Can you talk about how that action item intersects with House Bill 1019 that was just dropped at the legislature?
I'd have to go back and check, Jamie, just make sure. Is that the one that came out of the behavioral, the task force and not the interim committee? I'm just trying to.
No, it's the crisis resolution team program.
I would have to go back and take a look. I do know we do have legislation right now on CRT, and there's 2, and I forget which is which, but one of them absolutely calls out funding, continued funding for the CRT pilot program as is, right? So it really is funding what is currently occurring for CRT, making sure we can do that. And that might be the one. And if I misspoke, I apologize, so that I can come back with the correction.
Okay, that would be great. I mean, this looks like it goes beyond that. So, yeah, I think it would just be good to know how your action item intersects with what's in law, and if, you know, it encompasses everything that you're trying to do in this action item.
100%. And a lot of this is really, I mean, the assess they need, right? I mean, that's really where it's at, right? Like, how much money would it take? How many staff would it take? And what would that impact look like right now? So yeah, to probably affect future legislation. Next slide, please, Jason. Prevention, again, partnering a lot with our public health partners on this one. And the biggest piece is number 1, a little bit out of our control, but definitely an opportunity to support and our partners, is prevention funding is one of those things that is easy to come and go, right? It tends to be time limited. It tends to be like a grant funded type of thing. But long-term sustainable prevention funding, it really seems to elude us in a lot of ways. But so how do we do that? Right. So how do we, once we find and identify prevention programs that we want to fund, excuse me, how do we get that sustainable, flexible funding so it works for not only what we're doing now, but the things we want to do, you know, in the future? The piece here, again, that BHA is going to have a big role in is identifying the council for what this looks like. Prevention efforts, as folks know, in child welfare, is preventing from entering or further penetrating child welfare system, right? Or prevention for, you know, something else maybe for that system. So what are we doing at the statewide to ensure that we're preventing or working to prevent multi-system integration or high acuity behavioral health behaviors later on as a totality, right? Instead of just these siloed efforts. So we need to get a group together on that. Tasha, you have your hand up.
Tasha Conker here. Just a quick question. When it comes to these councils that the state's going to be creating, is there going to be any emphasis or a council created for children and youth with acquired traumatic brain injuries? Because that goes misdiagnosed so much. And that's a big, like, according to the federal government, it's like 80% goes misdiagnosed. So I just want to know if there's going to be like a council or emphasis put on that with assessment with brain injuries.
Yeah, we have a division within the state on traumatic brain injuries, and I'm just drawing a blank on their name at this moment. And if they're doing work, so when I say create, really identify is really hopefully the big word. Nobody needs to be in more meetings in their life, right? So if there's already a group doing this, then how do we tag on to it, right? How do we kind of jump in and help support that work that's happening? If we need to create it, we definitely feel like a prevention type group, right, is well worthwhile. So not specifically for that, but I definitely know that viewpoint and that lens and people who represent people in that community would be invited. Yeah, absolutely. And that viewpoint's really important. Yeah, of course. Jason, next slide, please. I'm gonna try and get through the next couple in 5 minutes, and we'll see to leave plenty of time for questions. But again, please don't let my timeline get in the way of your questions and your timeline. I mean, immediate priority number 4, these are our intensive interventions. This is the lawsuit, right? So in the video, in the recording that I did of this for this group earlier, I kind of talked about it just at a high level. This takes expands upon number 2 priority for high acuity youth behaviors for children and youth. This expands this. This really is looking at children with unique situations. So our IDD kiddos, our neuro-non-typical kiddos, our kiddos with disabilities, right? They have unique needs that are not addressed by the general population or general therapy, right? Access issues are huge. So there's a lot of pieces there, right? So this takes all the stuff from number 2 and kind of expands on it a little bit, right? Also, the lawsuit does absolutely focus on Medicaid kiddos, and we'll go further than that, but it definitely focuses on our Medicaid kiddos because it was with HICBUF, and making sure that there are longer term community level placements available. Like, part of the issue is these placements really haven't existed to the level in which we need them to exist for whatever reason, for funding or for workforce or for all of those pieces. So how do we first and foremost identify a list of what this could look like? What do we need in Colorado, right? I think we all have bits and pieces of what we think it needs and what would be beneficial, but a really robust list and saying, if we had all of this, and what are other states doing and how do we bring that in? So this is really a research deep analytic dive into what we have and what we need in Colorado. And then it really is working with our HICBUF partners into how do we incorporate that into Colorado's system, and then how do we pay for that either with Medicaid or for kiddos not in Medicaid. But these are our kiddos specifically for this lawsuit who have high acuity behavioral health needs, who a crisis or an event or something happens and they end up in a level of residential placement, and then they stabilize, but there is still no place to step down to. Right. And that's not appropriate to stay at these high level residential facilities for years and years. Right. So where is a safe place that can still meet their needs? And how do we fund that long term and make that sustainable for the number of kiddos we have in Colorado? Next slide, please. 5, again, the website for ACC is on there. There's a ton of stuff on at ACC. A lot of this really is trying to align our statewide efforts to align our Medicaid services and our non-Medicaid services, so that if you have private insurance or you have Medicaid, you're able to receive a same level of care, an equitable level of care. I think Kelly talked about it earlier, and I used the wrong word, I apologize, an equal level of care, right? So not equitable, we're getting an equal level of care independent of that funding source. So let's make sure we have everything available first. And then the next step really is making sure that we have equitable pieces so that those youth with whatever, again, anything else, neuro-non-typical or something else, they need something different. They're able to get that, right? Which isn't what somebody else needs. So ACC 3.0 is really kind of working at that whole Medicaid system. We definitely call out a couple of BHA programs here. Momentum for one, our SUD services for our youth is another, not specific service, but array of services. And you'll see these tasks are big, right? Assess the need and capacity for the full continuum of SUD services for youth in Colorado. That's a big one, right? So these are really big and comprehensive. And I just want to make sure that when folks are looking at this, there's a lot of pieces within each of these, right? Nobody feels like one person can just do one of these. There's a lot of pieces. So next slide, please. 6 is almost all BHA. This is us. We, with the work of the community, with the work of providers, we are currently on track for this, right? This is our BOSTO's implementation roadmap. We have number 1 completed. The request for information is done. We have a lot of internal work right now to currently draft scopes of work, right, on what this could look like, so that we will be on time to issue RFPs, requests for proposals, in early 2024. Right, so we need people or agencies to do this work, but we're spending a lot of time right now to make sure what is that work we need them to do, right? And again, aligning buses and arrays in the future, I think is what is some of the intent, to really make sure that we have a consistent level of care across the state. Next slide.
And then,
yep.
Matt, if I might just, I know we're gonna want to make sure we leave time for questions. I just wanted to touch on just a couple of things then, as maybe a little recap, and we can also do this after questions because there'll likely be follow-up. I'll say again, I thought, Renee, you brought up a really good point around rural communities. There are, we've heard a lot from mountain resort communities and we know that there are geographic, community-based particular needs of our children and youth based on where they live and what they've experienced. And so we've given you the highlight of the 6 immediate priorities. If you're wanting to dig deep, all the action items are in there. They're by department. It says who's responsible for what. Some of it, or a lot of it, guided by statute. The Coloradans have asked us, and through legislation, we've been charged with not just BHA, but all state departments, and the action items reflect that. And in addition, we know there's more work to do on particular populations, and over time, we'll make sure that we're assessing this, that we're adding to it. Again, it's a starting point, and we'll continue to do that. And so we just encourage you, if you take a deeper dive in, have more questions, please reach out to Matt and I. We've gotten really good public feedback since the release of the plan this past week. And I'll also share that all of these state departments, we're all statewide. We have, like, CDE has school districts everywhere. We have all the different departments out in communities statewide. So we hope we're capturing the particular needs community-based, but we also know there's a lot more community engagement to be doing. And so just to say, we know that this isn't a done deal, as we keep reiterating that it's completely done, and then in 5 years we look at it. But it's an ongoing living document, living plan, and we'll continue to engage you all in it too.
Seth, question, comment?
Yeah, hi, Seth Watkins. As I'm listening to the plan and what's being provided, I kind of wonder about services for transgender young people in rural or mountain communities, or from out of state, who come to Colorado for care and services, and to do the gender dysphoria requirements and see providers, and and not so much for like surgery or anything, but for like just support around hormones and puberty blockers, and like how are they being accessible for people in rural, mountain, and out of state communities? That's it.
Again, that's a big question, Seth. That's it. There's a lot there too. I don't know if we address that specifically in that plan to that level, and we're jotting down feedback for sure from this group, and I want to make sure. I think there's places in that plan, in our plan, that we're able to have that conversation, to find ways to do that. So I think that's really important. So I agree.
And I'll underscore that LGBTQIA as a population are one of the specific populations for all departments to be including in these plans. And so that's right, Matt. Seth, I don't know if specifically that question around transgender and the healthcare needs in particular is in it, but we'll note this for sure. So thank you, Seth.
I just ask it because last year there was over like 400 and 500 bills within state legislatures going after transgender healthcare services, and it's not just healthcare services. It's like part of the healthcare services is behavioral health services. To even be able to access the medical health services, you have to do like 2 years of therapy and psychiatry and stuff like that. And while you're doing the medical procedures and hormones and stuff too, like, so I know in Denver and the Denver area, there are a lot of resources for transgender youth, but it's the rural counties and mountain towns and out of state communities that come here because their state outlawed transgender care for minors, and it kind of needs to be a priority now because these young people are losing their mental and physical health care now in other states. Like it's already being taken away from them even in January of this year. And so like I think there needs to be a priority around, or a subpopulation priority around transgender youth in Colorado.
Seth, thank you for naming that. I am capturing all of this information and really appreciate that.
Thank you, Seth. Renee?
I just wanted to just mention, I know Seth, this is something that is becoming it's a great awareness on the Western Slope right now. And there's some great training being done to professionals to help LGBTQ plus, and a lot of educating for the for providers with gender affirm care. So there's some good things, and I think this should be something that should be included in this plan. So there's something I want to discuss. That last month I was in a presentation that was an organization that is on the Western Slope, that is for youth run by youth, and it is high school age, and it is this exact thing of behavioral health, and they work a lot with suicide prevention. They were very adamant about, do not use I Matter. 988, any crisis lines, any of the ones that are available that you hear about, Safe to Tell. They were very adamant that they do not want, they tell other youth, don't use it. And it's because the systems start getting involved, and first thing happens, law enforcement. And this is, I'm just talking regarding rural areas. This is the Western Slope. And it has become to where these youth, they want to be heard. They want to be heard as to what really works. And a lot of what this plan goes exactly against what these youth have said. And these youth they've been in the system. They've had what's happening a lot with the text messaging and the Safe to Tell, the I Matter, all these crisis lines, is that youth that are retaliating against other youth are contacting the crisis lines and saying that they are this person and that they need help. And then they think it's great because then law enforcement gets involved. And that's why a lot of the youth are saying, don't do it. At least in the rural areas, don't do it. Don't use any of that. There's other ways. And their thing is, don't get systems involved automatically. See what, don't treat the youth as a business. Treat them as humans and ask them what they need. And they said, just give us some time to talk through and then go with us to get the help, not be hauled away or told, contact this place because that's who's going to help you. And so there's a lot of things that I think we really need to review. This is a good plan, but there's a lot of things that need to be talked to. We need to hear the youth voice through this, because I was amazed. I thought I Matter was a great thing. With the youth, it's not. And so these are things that we really need to look at. Yes, this is the system. The law enforcement gets involved. all these things, but it just traumatizes the youth more rather than someone sitting and saying, this sucks. Because what are the youth going to do? They're going to talk to a friend. They're not going to talk to an authority. And so I really think this is something that has been overlooked in really understanding and hearing that youth voice and what really does work for the youth.
Renee, thank you for raising this. And as someone who spent most of my career with young people, I know I echo your sentiment around we need to hear from young people to help inform it. And so I really appreciate that. And I'm taking note of, I want to follow up with you and have our team that does community engagement around I Matter 988 and to be able to connect with you if that's okay, Renee.
Absolutely. I mean, I've talked with these youth and I would love to have the youth come to the BHAAC, come to whatever committee to, and we even talked to them and they're like, oh my gosh, that's scary. It's like, yes, but they need to hear your voice. And that's what's vital. I think that's something that's missing because they've been to, residential treatment. They've been to these things and it's been horrible. It has not been successful. And so, and I have a son who also has been through this and he will never, ever try and contact help at all because of the horrible situation he had to go through.
Renee,
So,
thanks
please
for
do
raising
contact
that.
me.
And when we talk about in that first priority around advisory councils, like you saw in several places, identify or create, and there are formalized youth councils. There's lots of different ways in which young people are involved. And you're right, we need to make sure we're being really intentional about hearing from them as we do this plan, but also, and I'm hearing around 988, I Matter. And so I'm gonna have our team follow up with you to make sure we can make a connection. They don't need to come to BHA, we can go to them and we can do some outreach and hear from them. So if you're okay with that, Renee, I'll follow up with you from our team that does that and really appreciate it. One of the things which I mentioned earlier, and we've heard from Coloradans, is we can't expect systems to work for kids because they work for adults. And we know they need to be better for everybody. And this is you've highlighted a really great example of if it's just adult driven, we're not centering that child, centering that young person, and their voices need to be help inform it. So thank you, Renee.
Sure, you bet.
Thank you. And see one more hand up, but I can't see who it is.
I think it's Cameron.
Yep, Cameron.
Thanks,
Jamie.
Help us find them.
Hi, yes, this is Cameron Datello. I just want to add on a little bit more about what I've been hearing from the youth experience, particularly after a young person may pass away from suicide. In Pueblo, actually just about a year ago, my husband lost his first cousin who was a senior at Central High School. And the students afterwards were telling his family that they weren't allowed to talk about the passing. They weren't allowed to, they were getting in trouble for maybe crying or asking for time away from the classroom. I think they got mental health services for maybe a week after that, and that's about it. And have been asking for more support and services for a year now. And I had a similar experience when I was a senior in high school and lost my best friend to the same situation. And so I think just being able to give more resources after unfortunate events like that happen, and of course preventative resources as well. But I just wanted to share that experience, and I absolutely agree with bringing more youth to these different conversations. And I know there's a lot of councils and opportunities, but I do think that if the council can help get the word out to these youth and utilizing our communities and our voices to let them know what these opportunities are, because they're not aware about it, and a lot of times they hear about it when it's way too late.
Karen, I'm sorry for your loss, and thank you for sharing that and for elevating that need. And Matt and I are taking notes on all of this. And grief supports, there's all different ways in which young people and at different times need different things. And so that's what we're needing from our system, is to be able to have youth anywhere, anytime that they need it to be able to get what they need. And so we're not there yet, I know, but information like this, the stories you're elevating and that request around voice is really important. So thank you.
Yeah, thank you. I appreciate it. Jason, you want to go to the next slide just so that we have Kelly's email and my email on there for folks. And then I see one more hand. Seth?
Yeah, Seth Watkins. I hear what Cameron said, and in my own experience, my lived experience, when I was in middle school at the age of 13, well, my mother left when I was 3, and her whereabouts were unknown according to the courts. They couldn't find her. So she's presumed dead by now. But my dad died when I was 13, and we had a very traumatic childhood with very little stability. And after he passed, we went to foster care. So what I'm trying to say is that there needs to be grief counseling, not just around suicide, but like when young people lose a parent or a sibling, and it's not even suicide, like it creates traumatic, mental health like experiences, and can also lead to, follow up suicide ideas or ideation that, well, my brother died, so I might as well die too. And it's just frustrating because like those voices aren't being heard, especially in the schools. I mean, adults can deal better with grief than young people, but like, because we have more experience, but like young people, especially if they're like 7, 8, 9 years old, like they need some sort of grief outlet to let go of, and not just for like a week, but like maybe throughout their young adulthood, be followed up by social workers or care providers about how to live life without that parent that they lost, or how to navigate school without their brother being in school with them. It's just kind of like sad that schools aren't, that are like, some people were saying schools aren't even allowing the discussion of suicide or suicide ideation or grief, and that's really bad. And I think that the educational budget from the state should stipulate, and this is a legislative issue, stipulate that mental health services should be provided in schools. That's what I think would really help young people, is to have not just a school counselor who can like talk to them about their grades, or like talk to them about like drug use, or but to talk to them about like grief and real life issues, poverty, racism, like, and having therapists and even psychiatrists available to those young people. Medication management is a huge issue with young people because they don't want to take the meds because they don't trust the system and they don't trust the medication.
Sorry if I interrupted. Seth, thank you so much for raising those issues. And I know we're almost at time. We want to make sure we can get to public comment. So Matt and our information is on this slide. You probably know how to reach us all anyway, but it's on the slide. I'll say that again that we're not there yet, but we're going to get there. And it's going to take a lot of collaboration. It's a big lift to coordinate across agencies. And in this example, Seth, I know CDA is working hard, and we also can't expect everything through schools. And what can we be doing in communities and resourcing, again, because so many different kids, young people with disabilities, or somebody with trauma, or whatever that unique experience is, we need to be able as a state to provide what our children need. And this is what it's about. We'll be circling back with you all to do updates, to get more information from you too. I really appreciate Jamie's on the call. I know how involved counties are. If you all are from providers or clinicians, you all do lots of really good work in your community, and you're an incredible resource. And so we'll be sure to keep you included in this and help you to inform our work too. So thank you all very much, and feel free to reach out.
Thank you, Kelly and Matt. Really good discussion. Thank you for all the questions and the comments. I did want to highlight before we move to public comment, Carolyn in the chat wanted to mention that children and youth are safe on the Colorado support line, where they are talking to people from lived experience. And the number for that is 844-493-8355. And then you push star. So thank you, Carolyn, for putting that in the chat. That's a really great resource. And
it's 8255. I'm sorry, it's 8255.
8255. Thank you very much. 8255. Then push star. Now we're going on to public comment, and I'm going to turn it over to Megan.
Thank you so much, Jamie, and thank you, Kelly and Matt, for a fantastic presentation, and to all of you for your great questions and discussion around this work. As we are now moving into public comment, I want to remind us all, both the public and our council members, of our group agreements. So I just want to go through these one more time for everyone to listen and engage respectfully. Remember that differences of opinion are natural and useful. Have an open mind, be curious, and be bold. Everyone has equal voice and valuable contribution. Please take space and also make space, and keep on time. So with that being said, public comment is limited to 2 minutes per commenter. And so I will remind you at the 2 minutes. We will also put up a timer for each public commenter. And most importantly, I know that we talk about a lot of things in these meetings, and some of them can be really difficult and challenging to hear. And so the last group agreement, I know it's not on the screen anymore, but is that you can turn your screen off at any time. You can walk away at any time if things are challenging and difficult. Self-care is so incredibly important. And as always, feel free to reach out to me. I'm always here to support you. And so with that being said, we will now move into public comment.
Megan, this is Marina. Are you, we're doing raise hand for public comment, or are you seeking chat, public comment in the chat or in the Q&A? What's the call here?
Yes, I believe Sarah was opening it. If you have public comment, please raise your hand. And
Emily has her hand up.
Okay, thank you.
Thank you. Sorry, I can't see the hands. My apologies, Emily. But go ahead, Emily.
Oh, give me 1 second. Let me make sure oh, here we go.
I still have questions about how to give public comment. So I'm not able to participate right now. I'm still waiting for answers to my questions. Please mute me until the questions are answered, and please come back to me later.
Emily, you are able to make a public comment at this time if you are ready, and you can go ahead and voice that, or you can type that in the chat. You're available to do whichever works best for you.
Emily, if you want to type your comment in the chat, I'm happy to read it and accommodate you in any way I can to support you.
No, I have public comment to give, and I would like the full time to give the public comment. I just was told I would be given the instructions I need to give accessible public comment at this time, and I'm still waiting for that. So are we just going to go without the information I need to give accessible public comment? If so, then I need the time to start at 2 minutes for equal access.
Yes, we're restarting the timer. Emily, can you help me understand what you need?
Wonderful. So I want everybody to imagine you are raped. Somebody holds their hand up against your neck and you're violently raped. You then go to the appropriate ER and get medical care. You're then told to go to the walk-in crisis center, part of the BHA system. You are informed at the walk-in crisis center that BHA pays for, monitors, and is accountable for ensuring it is accessible, that the staff at the BHA funded walk-in crisis center with a crisis response team that you guys talk about being oh so great says, hey, we've got ASL interpreters on an iPad, but as the video shows, staff says, oh, that's too much work to turn on. You're just going to read lips. Reading lip is about 5 to 10% accurate. So you are then communicated as a disabled person. You are worthless. You are not worth the 2 minutes it takes to turn on an iPad with an ASL interpreter by the crisis response teams. And my request is of this council, please start attending the funerals. I have story after story, video after video of people with disabilities trying to access BHA and file complaints with BHA about what is occurring in your funded programs. And BHA is ensuring that we don't even have access to BHA. The failure to provide an ASL interpreter here after requesting an ASL interpreter for 14 months is part of sending the message. People with disabilities are worthless. Well, I will tell you this. We are 1 in 5 Coloradoans. And only 2% of us are accessing the mental health care system. We are underrepresented in the mental health care system. Vastly. It is not okay what's being done to us. And this meeting today was not accessible, and neither is the rest of your system. And it needs change and accountability now.
Thank you for your comment, Emily, and please reach out to me with any additional questions, and I will support you as best I can. And I do want to once again apologize for not having an ASL interpreter for you all today. We had one scheduled. There was an issue with, we were notified right before this meeting that they no longer had an interpreter for us. We had 2 scheduled and they no longer had them for us. And the interpreter company was working to get us an interpreter. They were unfortunately not able to have one throughout the meeting. And I really apologize for that. I realize that it's not okay. And we are taking every step we can to ensure that that doesn't happen again.
Do we have anybody else for public comment?
Jamie, I don't see anyone. I don't know, Megan, will you double check, make sure I'm not missing anything, but I don't see anything.
I do not see any more hands, but I can't see, Marina, I cannot see the public. I can only see the panelists. So
I
think
do
Jason
not
and
see
Sarah,
any.
can you confirm that there are no public hands?
Emily has her hand up again. Just thought I'd let you know.
I think, Megan, correct me if I'm wrong, but I think public comment is limited to 2 minutes per person.
It is.
So Emily, thank you for your comments, and it sounds like Megan is available to chat with you with some, additional follow-up with some of your concerns. And I'm assuming you have her contact information.
I will put my email in the chat. So that you have it.
Thanks, Megan. As Megan's putting her contact information in the chat, we are right at 12 o'clock. So I wanted to thank you all for a really robust and engaging meeting. I think we are just really rocking and rolling now with the BHAAC. Seth, did you have a comment before we ended the show today?
Yes, I did. Some council members had to leave the meeting a little bit early before public comment, or during public comment. So if someone, Megan, could follow up with some of those people if they need support.
You bet, Seth. Thank you.
I think that's a great suggestion, Seth. Thank you very much. Thank you all. It's a great meeting today. I appreciate you all. Have a wonderful rest of your day.
Thank you all. Thank you, Jamie, for being an amazing chair. We appreciate you.
Thank you.